Rosai Dorfman disease, also known as sinus histiocytosis with massive lymphadenopathy, is a rare benign disorder. It's characterized by an overproduction of histiocytes, which accumulate in the lymph nodes, skin, spleen, liver, and more. Histologically, it is marked by a phenomenon called emperipolesis, where intact cells are found inside histiocytes. Immunophenotyping and genetic studies show mutations in MAPK pathway genes. Clinically, painless cervical lymphadenopathy is the most common sign, though skin lesions, lung involvement, and other extranodal symptoms may occur. Diagnosis relies on histology and immunohistochemistry, which help differentiate it from lymphoma and infections like tuberculosis. Most cases resolve on their own, but severe cases may need treatments like chemotherapy or surgery. Though typically benign, recurrence can happen, especially in extranodal cases. However, the overall prognosis remains favorable.